I'm Dr. Patrick McCarthy. I'm Executive Director of the Bloom Cardiovascular Institute, and I run the cardiac surgery program here at Northwestern. In my career, I've done over 10,000 heart operations, and probably about 5,000 or more have been heart valve surgery. I do the vast majority of cardiac surgery. In my career, I've done heart transplants and assist devices. But now really I'm about 90% focused on heart valve surgery, both aortic and mitral valve surgery, bicuspid aortic valve disease and associated aneurysms, lots of complex reoperations, and also patients with atrial fibrillation.
My name is Jim Kelly. I'm 56 years old and I'm from Wheeling, Illinois. I had just been to the doctor about 6 months earlier for a physical, and I went in to see my ophthalmologist because I had some blurred vision. She diagnosed me with ocular migraines, which are perfectly normal. So I went back to my physician and I sat down in his office, and he says, "What are you doing here? You were just here 6 months ago." And I said, "Well, I had this vision problem, so they wanted me to come back and get rechecked again." And so he put the stethoscope on me, and he could hear the valve leaking right away. And he says, "I think you have a valve problem here." I was pretty shocked. I was in perfect health at the time. No symptoms whatsoever.
There's a variety of causes for why a valve would leak. Probably the most common in the United States is what we call mitral valve prolapse. It affects about 2% of people. And there are strings on the valve, I tell my patients, like strings on a parachute. And in this condition, the strings broke, essentially over on one corner of the parachute.
I was diagnosed with a prolapsed mitral valve with severe leakage and evidence of possible broken chordae.
So Mr. Kelly is a good example of a gentleman who showed up in his 50s and his valve's leaking a lot. What's the best option for him? You could repair the valve potentially, or you might have to replace it. In that group in particular, it's pretty much 100% that we're going to repair. The reason being that it should last him the rest of his life. The durability is excellent. He doesn't have to be on any blood thinners. The risk for infection long term is going to be very low. And so he avoids all those complications of having the valve replaced.
I was in the hospital for 4 days. I came in on a Tuesday, and I went home on Saturday morning.
So Mr. Kelly had a very uneventful recovery. He just bounced right back from the operation, and my understanding is he's doing great about a year after the operation.
I have pretty much all the original condition of my valve is still there, and he was able to repair it without replacing it. So I feel much better about that. I did not need a new valve. All the staff here at Northwestern is very professional, kept me informed of everything that was being done all along the way, so I couldn't ask for a better experience. I've had a very quick recovery. I haven't missed a beat since then.
For a patient considering mitral valve surgery, my number one piece of advice is to do a little bit of homework. Ask their cardiologist, where would you have your valve repaired? In general, they will tell you when you ask them point blank.